Hey y'all, I'm here again on Monday at my clinic, Results Physiotherapy in West Mobile. Kayla Mowdy, Doctor of Physical Therapy. I am fresh off of a 3-day weekend of education. I was in class or lab, mostly lab, for 26 hours this weekend. We did Friday 12 to 9:30, and then we did 8 to 6 on both Saturday and Sunday. And I was learning about dry needling. So I just want to share with y'all what that is, and the purpose of it and how it can be integrated into a regular physical therapy plan of care to help you meet goals faster. So dry needling is using a needle without an injection. So that's why it's called dry, because there is no liquid or medicine being inserted into the muscle. It's purely using the needle as a form of mechanical deformation of an area of the muscle that we choose to treat. So what does the needle look like? I have never really touched one of these without gloves on, because we do glove for any time we're inserting it into a patient. There is the needle. It's tiny. The camera won't even focus on it. But we use this needle with this tube to insert it into a muscle. I'm not going to do it because I haven't cleaned my skin or I don't have gloves on, but I wanted to show you. We locate the muscles. I was trained in 40-something muscles this weekend, so a lot of our big problem areas, I see my shoulder rising up there. Upper trap has a lot of tension, a lot of the cervical muscles, low back, hamstrings, gastrocs, some stuff in the front of the knee that's really important for people with knee pain, and also runners and athletes and such. So what is the point of sticking the needle into the muscle? Areas of tight muscles sometimes can inhibit our plans of care. So I can use my hands, I can massage, I can stretch, I can teach you all these things, and this muscle still won't let go. So what's going on at the cellular level of that muscle is there is an overactivity. There's too much neurotransmitters that make that muscle fire, and that muscle is staying tense and staying tight. It can't even get enough blood flow to the area to help get the old chemicals out and new chemicals in and restore normal function. So what this needle does is it creates a mechanical change directly into the area of taut band. We call that taut band a trigger point. The trigger point might not actually be painful. It may be the tendon attached to the trigger point you're having problems with. It may just be that you're extra tired after running, or you can't quite get to the next goal of fitness. You have some barrier to getting to your goals. We can take our skilled hands and assess that and assess areas of weakness. A lot of times there's an imbalance. With these tight muscles and with these taut bands comes weakness. They can't contract fully. They can't get their full power. So what we can do is we can stick this needle in it, and the actual insertion of the needle into the muscle is painless. I had 200 of them stuck in me this weekend. Every muscle I did every muscle. They worked on me so I could feel what it feels like. It's not actually the insertion of the needle that is that causes any pain at all. Like, a lot of times you don't feel it, especially if we miss like the superficial veins and arteries and stuff. They don't bleed. Everybody's like, do they bleed? Out of the 200, I maybe had 4, 5, 6 of them bleed, and they were just little tiny droplets of blood, because we're really not breaking anything. We're not tearing anything as the muscle goes in. It's so sharp that it's actually spreading the tissue. I wish it would focus on this for y'all. But it's spreading the tissue. But when this is inserted into that taut band that is not used to getting attention into it, a lot of times it's deep, y'all. I mean, it can be in there, and you don't even realize that muscle's that big and that taut and just that knotted up. When the needle is inserted into the muscle, it twitches. That's what we want. We want the localized twitch response. We want that twitch because what it does is that resets the muscle. It gives it a chance to get all those old chemicals out. It brings new blood flow in. It gives the chance that muscle a chance to reset. So we'll go in there, we'll get 5, 6, 7, 10 twitches. And that's probably what people would call painful, is the actual twitching of the muscle, the tightness. It feels like a deep ache sometimes. Once we get into the right spot, it's like an ache. Like you just really need to stretch that muscle. And once it starts, we call it pistoning. So we piston it, and once it starts twitching, it may actually send pain to other areas, down to the tendon, areas of referral. These trigger points aren't always painful in the spot that they are. A lot of times they're painful downstream a little bit. And we have to do some investigating and use our clinical skills to find what the real cause of the pain is, maybe somewhere else up the stream. So the idea is it twitches, it wears it out. You feel kind of tired, like you just got done working out that muscle, whatever it is. You get to stretch it. We teach you exercises to go along with the needling and the resetting of the muscle. We give you some stuff to work on at home. We usually don't needle more than once a week. We can also run electricity through the needles. So if I'm not, the electrical stim that everybody likes and feels good and stuff, we actually use direct current, which can stimulate the muscle. So if I'm having trouble getting a muscle to fire, if somebody's foot's dropping or something, I can put needles directly into the muscle and stim that muscle and get that twitch, and it's resetting the muscle to fire better. It's teaching the muscle and the brain how to find that muscle that it's forgotten about completely. So there's probably 2 different methods you can use it for, is for pain relief and to release the muscle, but also to wake up the muscle and get it firing again and doing the right thing that God made it to do. That's all I have for you. Please, please, please ask questions. This is like my first go around on explaining it. I've explained it to a few patients before the class. I've got a couple people lined up, hopefully 1 or 2 today, and a few more throughout the week. Just patients I haven't been able to accomplish my goals with. So I want to add this to their plan of care, and I'm so excited for them, and I think they're excited too. Just because it's new and it's cool and it has so much research. We had to read 10 articles that are like 10 pages long before the class, just to know what's out there. Why does it work? We may not know exactly why it works. The biochemical model is a really great model, but it works, and that's all we know. And I hope that I can share this with a lot of my patients and get them to feeling better faster. It is a copay for now. It's a $40 charge at our clinic to have this added to your plan of care. But if it can save you 3 or 4 visits on the back end, if you can get better faster, then it's saving money, saving time. Our time is quite valuable nowadays. Comment with questions. Let me know if you have any clarifications that you think are needed. I love feedback. I hope that this is legal in Mississippi as well for all my Mississippi friends. Okay, I'm back. Mississippi folks do have to have 2 courses. They have to have a total of 50 hours of education. Here in Alabama, we just have to be trained on the muscles that we're needling. So I have a list of muscles that I'm allowed to needle, signed by the instructors, so that covers me for any of those. Those are the only ones I feel comfortable with, but they're the big players: the upper trap, the glute medius, the hamstrings, quads, gastroc, really good muscles that can benefit a lot from being needled. So let me know if you have any questions, and I'm going to get to work. I gotta check email and a few other things. I hope everybody has a wonderful Monday. Bye.